Hi, this is ARUN a consultant ENT head and neck surgeon. I made a talk on mucormycosis, black fungus. Right now, it is a headline in all the newspapers and all television channels. So, what is black fungus or mucormycosis? In previously, we used to see around 7 to 8 cases per year. Right now, we are seeing 7 to 8 cases every day in OPD. So, it's quite alarming for all the medical fraternity. The patient presents with severe headache, facial pain, and retroorbital pain. That is pain behind the eye, and there will be a swelling of eye, redness of eye, and total vision loss. Sometimes patients present with meningeal symptoms like headache, vomiting, and patient goes to stroke. So these are alarming symptoms patient presents with. So the mucormycosis can be divided into three things. Mucormycosis can present like patient only in the nose or in sinuses. That is stage 1. Whereas stage 2, it may invade the orbit, that is eyes. The stage 3 is from the nose to sinus, it may travel to the orbit through the cavernous sinus, that is pterygomaxillary fissure, it goes to the brain, that is called rhino-orbital cerebral infarction. So that is a deadly disease. It may lead to mortality in a lot of individuals. So if the disease confined to sinus and the nose, the prognosis is very good. So as a ENT surgeon, we play a vital role, in treating mucormycosis confined to nose and sinuses. We have good endoscopes. We do, debridement with microdebrider, which all the sinus can be cleared and the infection can be stopped in the level of sinus and the nose. If the mucormycosis goes to the eye, the ophthalmologist come into the role. It's a multidisciplinary action. All the ENT surgeon, ophthalmologist, and there's a multidisciplinary approach for treating a patient who develops a orbital complication. And the third stage, the fungus reaches the cavernous sinus and lead to meningeal symptoms like that involves the cerebri. It is very very deadly complication. It may lead to a lot of catastrophes. So the initial diagnosis and as soon as the treatment should be started, so can save the patient's life. So as a ENT surgeon, what we should do is that a patient present with symptoms of mucormycosis, the immediate action should be taken. The treatment should be started as soon as possible. If there is a delay in treatment, it may lead to lot of complication and death. So as a ENT surgeon, we should be very aware and we should start the treatment as soon as possible. The first thing, the diagnostic thing is put a nasal endoscopy and see is there any blackish discharge or blackish crust seen in the nasal cavity, and suspect it could be mucormycosis. Start on antifungal as soon as possible. There are only 3 or 2 antifungal worldwide that is effective towards mucormycosis. All the antifungal is not can treat mucormycosis. The mainly right now we have injection amphotericin B. It is very very rare to get right now in India. So like posaconazole 300 milligram can be given as a BD dose. So these are the treatment modalities we have right now in our medical service. So the treatment should be started as soon as possible. And if the mucormycosis is confined to nose and sinus, the debridement should be done as soon as possible. So can just read the can prevent the complication to the eye and the brain. So something normally what happens is that the COVID patients right now, the symptoms is a patient who's affected with COVID, they are treated with steroids. So if the diabetic patient is treating with steroids, the sugar value will go high. So and a lot of fungal development can take place. That can be formation of gangrene in post-COVID period and may lead to lot of complications. So if a patient is diabetic, affected with COVID, and there should be a minimal use of steroids. So initial 7 to 10 days steroids can be stopped. You should not use steroids in initial phase of COVID. The next, after 7 to 10 days, the steroids can be started if saturation come down less than 90. If saturation is above 90, please don't give steroids. That's my kind advice to all the medical fraternity. So, so please be careful by using steroids. Steroids are double-edged weapons. So it can be beneficial, it can be a catastrophic to the patient. So as a doctor, we should be very concerned with the patients while using steroids. Steroids are double-sided weapons always. And normally we encounter in OPD the normal patients, like patients comes with treatment for cancer, treatment for chronic kidney disease, can develop mucormycosis previously. Right now in this pandemic era, the patients, normal routine diabetic patients, are not following with the diabetologist, they're not going to regular checkups, they're not regularly monitoring their sugars. So there are a lot of mismanagement in diabetic care. So all the patients should go for normal diabetic checkup, should check their sugar levels regularly and keep your sugar under control, and just get your, if you're very afraid to go to the hospital, get an online consultation with the diabetologist and just keep your sugar level under control, and just do a lifestyle modification. Just go for walking and keep your diet very strict. The diabetes is very dangerous. In case of COVID, if you have diabetes, you should be very careful. And if you have diabetes, the sugar level should be under control, so the prognosis will be very well. And normally we do steroids can be given after 10th day of COVID if saturation come down less than 90. So normally don't give steroids. That's my kind advice. If steroids are given, the sugar value peaks up, and there will be a lot of fungal development. There will be end arthritis in all the sinuses and the nose. It may lead to gangrene and fungal formation, and it may lead to complication to the orbit and complication to the brain. So after COVID, just check your sugar level periodically. So don't let the fungus to grow and just lead to complication. That's my kind advice. Thank you so much. Be safe. Be stay indoors. Be safe. Jai Hind.